Good afternoon. My name is Edna Navarro-Vidaurre, and I am the Senior Community Engagement Associate at Illinois Action for Children. On behalf of Illinois Action for Children and the Consortium for Community Systems Development, we would like to welcome you to today's exciting webinar highlighting the accomplishments and lessons learned so far from the Innovation Zones. Today, leaders from the Aurora and South Suburban communities will share systems alignment strategies used to promote and improve early learning programs. Next slide, please. Today's agenda includes a brief overview of the Innovation Zone stories from the Innovation Zone leaders, a response from the Office of Early Childhood Development, and after the two presentations, Renee Tetrick, Innovation Zone Analyst, will facilitate our Q&A session where we will try our best to answer your questions. Next slide, please. To get us started, here are some housekeeping tips. The session is being recorded and will be available later on our website for viewing. All of the participants have been muted. If you encounter technical issues, please use the chat box to send us a message about your technical issue or send an email to maya.wilson@act4children.org. As each presenter shares their stories, we encourage you to please use the chat box to submit your questions, which will be used for our Q&A session. Next slide, please. At this time, I would like to introduce Leah Powell, Director of Program Innovation, who will give us a brief overview of the Innovation Zone initiative. Leah?
Hi, Edna, and thank you for putting this together. We're really grateful to the Consortium and Partner Plan Act to be offering this opportunity to share some of the work of the Innovation Zones out with other people. So the Early Childhood Innovation Zones are an initiative that is funded through the Race to the Top Early Learning Challenge grant. Our work has been designed to help the state learn which strategies are most effective in achieving the goal of ensuring that more young children with very high needs are enrolled in high-quality early learning and development programs. The Innovation Zones have been using a systems change approach as they work within existing collaborations to develop goals, to test and implement different strategies in one or both of the following areas. So the one area that they do a lot of work in is to enroll and serve more very high-need children from priority populations and high-quality early learning and development programs. The second goal area, which we'll talk about today, is to increase quality in early learning programs. And so that's to increase the number, that's measured by increasing the number of programs that are in Accelerate or moving up to a higher circle of quality. We have 11 Innovation Zone communities statewide: Altgeld Gardens, Riverdale community area in Chicago. We're in Austin, Aurora, Cicero, Elgin, Englewood, Greater East St. Louis, North Lawndale, Pilsen and Little Village, the south suburbs of Cook County, and Williamson County. The Innovation Zones have been doing amazing work. They're using data, they're testing with small experiments, they're adapting as they go. We're excited that they're going to be able to share some of these experiences with you today. They've all come so far in implementing and adapting their initial strategies. Again, we're grateful to be invited here today to share with you some of their efforts and their early wins so far. And with that, Edna, I'm going to turn it back to you. Thank you.
Next slide, please. Thank you, Leah, for that introduction. Our first presenter is Trish Rooney from the Aurora Innovation Zone. Trish?
Hi, Edna. Good afternoon, everybody. And Edna, thank you for inviting me to share our quality initiative, which we've embarked on in the Aurora community. Can you turn to slide, please? So our early childhood collaboration Aurora is known as SPARK, which stands for Strong, Prepared, and Ready for Kindergarten. Next slide, please. What we have in front of you is an overview of our conceptual framework, and SPARK is an early childhood collaboration, like I said earlier, for the City of Aurora. It is a collaborative partnership that was initiated by Fox Valley United Way, the City of Aurora, East Aurora School District, West Aurora School District, Indian Prairie School District, and Oswego School District. Its mission is to ensure that all of Aurora's young children have equal access and equity to early childhood education. And what you're viewing there, actually, this conceptual, the conceptual framework, actually, what it depicts is the entities that strategically guide the work of Spark, as well as the various focus areas of the collaboration which have formed our subcommittees. Next slide, please. For our work with the Innovation Zone, as Leah has shared earlier, we have chosen to pilot an initiative that's focusing on quality. Our hypothesis is that strong leadership is a key that will lead programs to be successful moving through the Accelerate Circles of Quality. At the time that we started the collaboration and embarked on this initiative, we were faced with only 5 early childhood programs that had participated in the former QRS program, 3 of which were child care centers, and 2 were license-exempt family child care homes. Additionally, in Aurora, we did not have 1 accredited program at that time. So our objectives for the Quality Initiative were to develop leadership trainings and provide support to directors and programs through a mentor cohort program. Our planning team consisted of the YWCA, Child Care Resource and Referral, quality specialists, and stakeholders with EC leadership experience, primarily from Waubonsie Community College. Next slide, please. So just for a reference point, this is where we're at this point in time of the number of who has achieved a gold circle quality, silver, and bronze. Next slide. So this slide depicts the growth and movement of our Aurora programs through Accelerate once we embarked on this quality initiative. As the graph demonstrates, we've had a dramatic increase in participation and achievement of circles of quality, most notably the number of programs who have achieved a gold circle of quality. Another important item to note is that some of our programs are choosing to bypass bronze and apply for silver. So you'll see that movement of the jump right into silver. Next slide, please. So part of our work, as Leah has shared with you, is really learning and reflecting on what we've embarked on and this idea of build, measure, learn. So we've adapted this strategy as we've progressed along. So after completing year 1 of the Leadership Academy, we had to come up with a plan on how to provide continued professional development support to the existing participants. Through feedback from the participants, we decided to adapt our design to a community of practice. Participants from year 1 asked that trainings and supports be extended to their teachers and other EC programs such as home visitation, family case managers, and parent liaisons. The current model that we are in for this fiscal year have started meets monthly alternating from workshops followed by a leadership cafe to further discuss the topics prior. Additionally, we've chosen to focus training and cafe in a book called Lead Simply, which is by Sam Parker. Lead Simply focuses on 3 core areas: model, connect, and involve. Leah, would you be so kind to show a snippet of that video? Or Maya?
Sure. Maya is going to be able to do that for us. Great. Perfect. So for each person, I think if you turn up the volume on your computer, then you'll be able to hear the video, what they're saying. So we're getting some feedback that we're not able to hear the volume. Trish, would you mind taking a moment just to share a little bit about how you've used this video?
Yeah, I was wondering if they could actually hear it. So the idea of us choosing this video was in the hopes that our leaders will be inspired to encourage their own teams and to embrace these simple rules of model, connect, involve to gain better results and big impact and greater impact. In this case, it's accelerate. And the reason we chose this video is because we really did embark the first year in a very in-depth, rigorous curriculum with our directors. And as some of you may know, there's the rigors that come with Accelerate as well. But we wanted our directors to understand that all this could be accomplished if we keep these 3 factors in mind as we lead and motivate our staff to achieve greater quality in our programs. Meet for our workshops and our cafes, we'll be focusing our conversations and topics on these 3 concepts of model, connect, involve. And see down there, I don't know if the appropriate phrase is word cloud. We wanted the community of practice, we okay? To be something that was owned by the participants. So the participants have actually helped design the community of practice this year. The word cloud that you see down there has been personalized to this community of practice. It depicts what they hope to learn, what they hope to gain, and what they hope to share with their peers here in the Aurora community. All right, next slide. So what we've learned, so in the time that we started a Race to the Top and started our work with our early childhood directors, what we've learned is that directors and staff do benefit from the support of a mentor. And the mentor has been of more value, to be perfectly honest, more so than the cohort model. That one-on-one has been of extreme value, especially to our child care center directors who have really struggled with just trying to put the pieces together and take the first step. And also, as with most, I think, individuals embarking on any sort of leadership, it's moving from transitioning directors from managers to leaders and really understanding what the difference is between those 2 types of leadership. And this 3rd bullet is getting out of the practice of just referring to gold programs as the quality programs. In a community like ours where everybody is sincerely working towards providing quality programming for children, we really have to value where everybody is at. So we really have become accustomed and are sincere when we say that all programs that we acknowledge all programs should be acknowledged as striving for quality if they're actively participating and accelerate, and that all efforts should be acknowledged to build motivation and momentum. So it's kind of become a mantra for us here in Aurora. And quality, another item we've learned is that quality specialists provide support when programs are working towards silver, but this practice needs to actually begin as they move from licensing to bronze. Typically, programs at this level have directors with the least amount of leadership experience, therefore lack the skills to support and motivate their own staff. And so that is a recommendation that we would like for some consideration for Accelerate, is that support be given at the beginning. All right. Thank you, Leah. So if you need to, if you have further questions after this session today, here's my contact information. We invite you to visit our website to learn a little bit more about Spark, and the content that was shared with you, the bigger PowerPoint presentation actually can be also accessed from our website. And also new to our website for some of you, and you're more than welcome to download and use it, is the new 2016 Early Childhood Calendar, also can be found on there. Thank you.
Thank you, Trish, for sharing Aurora's story. We invite all of our participants to please remember to submit your questions on Aurora using the chat box. Next up is Carlos Patton from the South Suburban Innovation Zone. Carlos?
Good afternoon, everyone. Edna, I also would like to thank you for inviting me to share in on this webinar. South Suburban Innovation Zone. Our core team consists of child care programs that are quality rated, next slide please, are quality rated through the Accelerate system. The South Suburban Innovation Zone consists of 6 communities, which are Dalton, Harvey, South Holland, Calumet City, Riverdale, and Lansing. The team is a cross-sector of professional child care centers, preschool fall programs, school district, and Head Start programs. We are in innovation zones of different communities coming together to figure it out and forming the process. Next slide, please. Our strategy is to get cheerleaders in the South Suburbs that could get unengaged centers to think about obtaining quality in their programs. This is done by building a community of practice, which allowed the core team from each community to go out and recruit 5 additional child care centers members that did not have a circle of quality. In addition, we became a support for the centers by providing them with resources that they need, such as connecting them to their quality coach, providing professional development, and connecting them to Illinois Action for Children. Next slide, please. In the South Suburbs, our resources are scattered and not connected. We know in order to have quality pieces, pieces should be in place and available for children and families. One of our goals is to go from not working in silos to increasing shared knowledge of high-quality education through bringing child care centers, school districts, social service agencies together in the South Suburban community. Next slide. One of our goals is to work together to bring resources and ensure that we enroll from priority population, such as homeless children, teen parents, DCF children, foster children, children from disability, children in poverty and deep poverty, children in home-based child care who need supplemental early learning services, and children who are experiencing language barriers and putting them into high-quality programs. Next slide. Our second goal for the Innovation Zone is to gather leaders from the 6 different communities in the South Suburbs. And as I stated earlier, the core team consists of the owners and directors that are dedicated to quality improvement in their child care centers. The core team were willing to build commitment care centers were connected to their quality coach and received additional resources. Being a part of the core team also allowed the centers to apply and receive the Preschool for All expansion grant. Next slide. Our third goal is to help early learning programs to meet all their family needs by forming networks which service providers such as housing, dental agencies, WIC, food pantries, doctor offices, GED programs, mental health services, and others. With that being said, servicing children from the priority population, implementing quality and early learning programs, and developing a network of social and health services are the key to providing high and enriching quality resources to children and families served in the community. Next slide. However, providing the services is not enough. When working with family at risk, there has to be an intentional plan to help families through the different processes. So therefore, a well-developed referral process is needed to ensure families are not overwhelmed or lost during the intake and enrollment process. So this plan is shared with the child care centers, school district, social service agencies so that everyone understands it. Our intent is to walk fragile families through the process of enrolling into high-quality programs. Next slide. So what did we accomplish? The South Suburban Innovation had the opportunity to meet child care centers in a community that had little or no knowledge of Accelerate. We met 15 child care centers that were excited to come on board to learn how to obtain a circle of quality. There was excitement. They were all excited to partner with the centers that had goals, circle of qualities, and work with these centers that could mentor them through the process. Next slide. Lessons learned. We learned that you need to know your community. That makes the whole process easier. Don't be afraid to start over. There were times that we started a plan. It wasn't the plan that was the best for the community, so we started over to fit the plan with the community. And we celebrated the small successes. We learned that celebrating small and working up to bigger wins was the best for us. We built relationships as we left our office and went out into the community, and we worked with the child care centers. And then we stopped making assumptions about child care centers not wanting to be engaged. And what we found is that people wanted to be engaged. What they wanted was clear and concise information that for someone to help them. Next slide. If you'd like to know more information about the South Suburban Innovation Zone, here's my contact information. You can call me at any time. Thank you.
Thanks to both of the Innovation Zones for sharing your community stories. Please remember to submit your questions using the chat box. I would now like to introduce our next guest. Joanna Sue is the Community Systems Policy Director from the Illinois Governor's Office of Early Childhood Development and will share the state's reflections on the Innovation Zone work. Joanna?
Thank you so much, Edna. On behalf of the Office of Early Childhood Development, I want to thank Carlos and Trish and their leadership teams for all of their hard work in support of the state's vision to see every child healthy, safe, eager to learn, and ready to succeed. I also want to express our appreciation to Leah Powell, Edna, and all of the folks at Illinois Action for Children who have been supporting these efforts. We know that collaboration and community systems building is hard work that takes dedicated time and resources. And we are, at the state level, taking the lessons learned from the innovation zones and other collaborations, and we are working to apply them across the state. So today, Trish and Carlos talked about their experiences in establishing peer-to-peer communities of practice, setting ambitious goals, and using data to track their progress, building a network of comprehensive services at the local level, and creating a referral system to connect families with those services. We also heard how those strategies are pulling together and enhancing the work of local providers and the existing supports, such as those provided by the CCR&R, rather than duplicating any efforts that are already ongoing. Those are the kind of strategies and approaches, especially using action learning and small wins, that our office would like to see replicated in communities across the state. So to grow and support this kinds of system development, our office is working with state agencies to put into place a coordinated set of state supports to community collaborations. The lessons learned from the innovation zones, like the ones we heard today, as well as feedback from other collaboration initiatives, will continue to shape our system as we go forward, and we really thank you for being part of this effort. Back to you, Edna.
Thanks, Joanna, for sharing your thoughts on the Innovation Zone work. Renee Tetrick, Program Analyst for the Innovation Zones, will now direct the questions participants submitted via the chat box to our panelists. Renee?
Thanks, Edna, and thanks to those joining the webinar today, and for all the Innovation Zone presenters. I want to invite you to type your questions into the question box. I'll go ahead and give just a minute for people to think about their questions and type that in. So while we're waiting for questions to roll in, I have one that I'd love to ask our Innovation Zone presenters. I'd love to hear from you. What would you say are the benefits of being an Innovation Zone and using the sort of community systems framework? Maybe Trish, do you want to go first?
Sure. So the benefit of being a part of the Innovation Zone for us here in Aurora, when the collaboration started, it was always on our radar, or it's on our radar to support programs and to do do some work associated with professional development and accelerate. And to do that work by leveraging our partnerships and building on that capacity. Being a part of Innovation Zone, I would say, definitely has allowed us to do that in a much faster manner than what we had projected. So I wouldn't necessarily, whereas we've had to ramp up, some may think of that as stressful, but for us it was really an opportunity to take all these ideas and thoughts that we had about how we could support our community but felt limited because we, by guidelines, current policies that exist in the state. So Innovation Zone allowed us and gave us basically the thumbs up to say, go ahead and try it. Try something different, try something new, and let's see if it works. So it allowed us to be in this risk-taking stage of our work. And what we like about the Innovation Zone is it does really appreciate that community systems work is a process. Often in early childhood, we talk about process versus product and the value of the process. And so as part of Innovation Zone, there is a lot of value placed in the process and a reflective piece of the work associated with it. Thank you, Renee.
Great, thanks. And I'd love to hear from Carlos. How about you? What would you say are the benefits of being an Innovation Zone?
Okay, so yeah, in the South Suburbs, because there are so many different townships and things, people have never had an opportunity that lasted this long to be able to come together and talk about, first of all, what do we have in our communities? What can we improve? How can we work together? How can we stop working in silos? And so the Innovation Zone for once brought different child care centers, the school district, home providers together to be able to even start a dialogue and start thinking about, like, how can we work with each other? How can we make the South Suburbs a better community for all of us? How can we stop thinking about that there's only enough children just for me, and how can we share and make sure we help all families? So with the Innovation Zones, this is the first time that I've seen where people are actually talking, sitting at the table, working together, playing nicely, and thinking about children, all children, and not thinking about what it is that my center can get, what it is that my home can get, but thinking about how we can do this together to benefit the South Suburban community.
Thank you so much, Carlos. And I want to again invite our attendees to submit your questions through the question box. And we have one here for Carlos in the South Suburbs. So the question is, she's wondering about the participation you mentioned from the school districts and the social agencies. So schools can be really difficult to engage at times, and she wants to know, how did this work out, or is it still in process, this idea of working around schools' schedules and getting them to participate?
Okay, so yeah, in the beginning with the school district, we thought that was going to be the hardest part because honestly, we had never had a real engagement with the school district. What we did was we started off with making phone calls. That did not work for us. What we did was we left the office and literally went to the school districts and met with the principals. Once we got into the school district, we saw that they were friendly people. They wanted us to come, but however, no one was ever making that connection. So how did we do it? We went into the schools, and they are some of our most engaging people at the table. They come to the meetings. They want to be involved. They've been saying they've been thinking about this for the longest, just didn't know how to bring child care centers and school districts together. But yeah, we just actually went out and we made appointments. Actually, no, we didn't make an appointment. We made appointments afterwards. We actually went and just said, can we talk to you? And that's how that got started.
That's great. It sounds like a lot of deep engagement and relationship building there. I have another question I'd love to ask. So Innovation Zones use this model of testing small experiments and working in short data-driven learning cycles. And thinking about your quality strategies, I'm curious, where did your Innovation Zone adapt a strategy when an idea didn't work out as planned? So maybe we can start with Trish again. I'd love to hear your thoughts.
Yeah, when we started the first year with Leadership Academy, we had a pretty we had we had conditions where they had to attend so many, they had to attend the full Leadership Academy to actually be able to participate. And that idea actually went right out the window as soon as we started hearing feedback of the challenges that directors face with scheduling and staffing and things. So we really had to adapt the format of the Leadership Academy so that there was an opportunity for directors to feel welcome at any one point, and making sure that that curriculum that each session could stand on its own and not have to rely on the prior workshop. So that's, ideally would have liked for everybody to come to all sessions, but that just wasn't happening. It wasn't going to be a reality for some of our directors. So we did adapt in that way. And then coming into year 2, we adapted again because they were feeling that what they were learning, they really wanted to include some of their team members. They thought they could broaden their knowledge and experience by interacting with folks outside of child care centers, and that's where home visitors and family case managers came into the picture. Thanks, Renee.
Thank you so much, Trish. And Carlos, how about for you?
Yeah. So one of the things that we started and we threw away was when innovation zones came around, we wanted to succeed, and we wanted to be. So we were sitting at the desk and we were making assumptions about what child care centers needed. So we were coming up with a plan and we were going to deliver it to the child care centers. Well, we had to throw that all away. What we found is that we had to go out to the child care centers and to the school district and see what they needed. So our strategy of coming up with this plan, and we were going to deliver it to our community of practice and our core team, that we had to throw it away. What we did was we had to literally get up from the office, go out and talk to people and see what their plan was, which was so much a better plan than what we had and was much easier. And once we did that, we knew then the assumption making or what we think people need is not the way to go, but literally going out and letting people tell you what they need. And from there, it makes their life easier, and it makes the work for us easier.
Great, thanks so much, Carlos. And I have another question here from our participant. I'd love to ask the Innovation Zones, what was sort of the most beneficial or valuable training and supports that you've received as Innovation Zone leaders, either before or during your time as an Innovation Zone? So maybe Trish, do you want to start again?
So, for us, not that we've given to our directors. Right? Yes. Gosh, we've had a lot. I think one of the most valuable things that I've gotten out of my participation with Innovation Zone and with my peers is what we've learned from each other, and that has been such a benefit to our growth. For me personally, leading this collaboration, but also for our growth for the work that we do in our community. A lot of times, these conversations and these community practice that we have for Innovation Zones allows us to hear the different ideas that's going on, and think about how that would work for our community. Another thing is this whole idea of really understanding this build, measure, learn. This idea of a lot of times, when you think of programming, you think of it from beginning to end, and that there's no staggering, there's no pivots, and that has been something that has really helped in how we lead in our communities, and it has engaged more of our stakeholders to be a part of the conversation, because we've really we've really given the green light that that's the way we're going to practice. It's okay to give feedback and comments that you don't think it's working. So let's think of a better way to do this that meets the community's, or in this case, the child care provider's needs, the director's needs.
Great, thanks Trish. And how about for you, Carlos? What training and supports have been helpful to you in your innovation zone?
Yeah, well, first I'd like to agree with Trish. Coming together and learning from each other, that was really helpful, especially example, me learning from Trish and seeing what they're doing in their area. So just coming together and hearing people talk about what the obstacles are and all of that, that was very helpful. But also one of the things was digging deeper. I think many times we have a lot on our plate, and so when we're given work, we want to solve it immediately. So we just once again come with the assumptions. The digging deeper was really something for me because it really got us to think about what is really the problem. And so that was very helpful. Also, although we all think that we are good at coming to consensus, we're not. And then after some of the training, it was really helpful, and it taught me how you can take the pressure off of everyone by saying what's going to work, but coming to a consensus is like it's almost everyone agreeing even though they're not. So just the information on consensus, digging deeper, and learning from each other.
Thanks for sharing that, Carlos. I also wanted to see if I can invite Leah Powell to tell us a little bit about some of the training and supports that were provided to innovation zones. Leah?
Great, thank you, Renee. Some of the training that we do, we really break out the training that we provide into 4 main buckets of work. The main bucket being what Carlos was referring to, this idea of a discovery or a data scan, system scan, to really do a root cause analysis to look at what's really going on in the community. For innovation zones in particular, we look specifically at those 2 main goal areas, so related to priority populations being unconnected. So a guiding question was, why are families who are in priority populations not connected right now? And then related to quality, the question would be, why are our programs and centers not connecting to accelerate right now? So there really is an emphasis on getting that data to help with planning, to slow us down, to not jump to conclusions or jump ahead. The next stage is really about this planning, and so we call it, we have a couple of like kind of cute phrases that we use. One is keep calm and get outside of the building, and go slow to go far. And what those really are is to just help us slow down and make sure that any ideas that we come up with, coming up with a root cause, getting to the bottom of what's going on, that we design solutions that match the issues that come up. We also want to make sure that as we're designing solutions that they're reflecting engaged, diverse perspectives. So the people who use our system, so the providers, the partners, the people working, providing care in home, if we want them to participate and accelerate, we need to know from them what is making it hard for them. And that as we design, that we're really reflecting, and in our action learning process, we're getting information from the people that we're working with, rather than just staying inside and making guesses and trying to figure that out on our own. Another key piece would be putting a simple system in place to make it easier. And I think that this community of practice ideas is just really key to that. So for some partners, it might be really hard to get complicated information. They're busy, they've got a lot on their plates, they have businesses to run. Coming together in a peer group, you can ask the questions that you want, you can learn from each other to make it less complicated. Some other folks might feel afraid. Maybe they've never done anything like this. Maybe they have anxiety or fear. Maybe they tried to participate in one of the other quality rating systems before and it was complicated. So it helps them, a community of practice helps to increase motivation by making something that feels hard, making it feel easier, but then also helping them feel less afraid by giving them information and showing them that they can do it too, that their friends are in it, that their peers are doing it, people like me are doing this too, and by making it small. The other thing that we do, kind of part 3, is really on the implementation. So encouraging our innovation zones to experiment, to do these small, work for a small win, design yourself for a small win, and then build on that small win. Rather than having a big plan and then not knowing if it's going to work. A lot of what we're doing is based on uncertainty, and so when you do small wins, you can learn as you go, action learned, pivot, you could persevere, you could keep going forward, and then you can make adjustments. You're close to the ground. The innovation zones are working directly with partners and providers, and they can just ask, hey, is this working out for you? And then if it's not, they don't have to keep going. You know, as Trish gave a great example and Carlos gave great examples, they can change their course. And then the last thing is really building on successes. So they're not scaling up an idea that's not working. They're really just going to build upon where it's going. So I have a small win. I'm going to build on a small win. Those small wins are going to give us all a little bit more momentum. It's going to help us keep going. And then really just the idea of leadership. So having capacity, I think that the peer group, us coming together as innovation zones, the other folks talking to each other really helps them build their ability to keep doing this work, just because there's a lot that goes into it. So those are really the main things that we get to do. We're working with, you know, kind of data discovery, planning, implementation, and then the idea of leadership as a pathway for sustainability for the work.
That's really helpful. Thanks, Leah. I have another question here about sustainability, and I'd like to start first with our Innovation Zone leads and just get a feel for what are the types of things that you'd like to sustain in regards to your Innovation Zone work, and what are any plans or ideas that you have to embed and sustain this work after the Race to the Top grant ends. So want to start first with Trish?
Sure. So when we embarked on Race to the Top, our executive committee were, and we were as a collaboration, very intentional that the initiatives and the pilot initiatives we chose for the Innovation Zone lined up with our original strategic plan. So so that we can think about sustaining these programs or these concepts in our community. So as far as sustainability goes, I didn't talk about it today here, but our shared intake is actually a really good example of how we're thinking ahead for sustainability. So before we even finished year one, we went ahead and started to write for a grant to sustain and also build out capacity for that project. So at the moment, we went from, I think we started at 25 hours or so with Race to the Top, and now our shared intake specialist is at 40 hours. So we were able to sustain, to build capacity and talk about this work, use what we've learned from what Innovation Zone has allowed us to do in a very fast pace, but that's all been a benefit because we actually have something to talk about and see that it's working in our community and that our partners are seeing the benefits of the work and would like to see it continue. So we were able to do that. As far as the quality initiatives are concerned, how we hope to sustain that, and even with the shared intake, is always about leveraging our partnerships. It's about leveraging and strengthening our partnership with the Child Care Resource and Referral, with Waubonsie Community College, with Ounce of Preventions, any entity where we can develop a relationship to provide continued professional development for our early childhood practitioners is one way that we're hoping to sustain what we're doing now. And of course, grant writing will always play a picture in what we do, but it's just something that we didn't go into it without that thought in mind, I guess is what I'm saying, is that was really something we already had thought about, that if we're going to embark on this, we don't want to just do it and be done with it because Race to the Top is done. We want to do it and be able to sustain it for a much longer period of time.
Thanks, Trish. And I'd love to ask Carlos as well. Are there things at the local level you'd like to sustain, and any plans or ideas for how to sustain this work going forward?
Yeah, it is. One of the things that that we're hoping is to happen is that we change the dialogue about when we come together, what we're talking about. Are we talking about what can I do, or are we talking about what we can do for the communities? So changing the dialogue and actually talking about intentional things that we want to do and about how we can serve the most needy families and things like that. However, our teams are coming together already. They're already meeting. They're meeting with the community colleges and trying to put together cohorts. And so that's something that didn't exist. So they're already thinking of ideas of, once Action for Children, Innovation Zone is over with, how are we going to continue this? The other thing is they all, 6 of the core team members received the Preschool Fall Expansion Grant. So once again, they're meeting with the superintendents and the principals of the school district. I think they meet quarterly. So the team has already started some of the things of how they're going to come together. They're changing the dialogue of what they're talking about and how can they be intentional, and how are they going to move forward even once we're away from the table.
Thanks so much. And I'd love to ask the same question of Leah Powell. What are the plans to sustain this work moving forward after Race to the Top ends?
Hi, Renee. Thank you for your question. I think what we have been talking about with sustainability, and I appreciate how Trish and Carlos have spoken about this as well, because it's something that we put in from the very beginning, knowing when we started that this work was going to end and that we had to design our approaches for sustainability. One of the reasons why we've taken a systems change approach is because it's through the practice of changing our habits that the systems can change, and when systems can change, then the work can be sustained. So the Able Change framework is something that we look at as well, and they have a really nice way of talking about that, just in terms of changing system habits, changing the habits of ourselves as providers, practitioners, and our collaboration, kind of changing how we do what we do. In some of our innovation zones, that might be that a medical partner who's been located in a community has added something new to a form, or our pediatricians are saying one more sentence that they weren't saying before. So these are practices and habits that aren't costing money for the innovation zones to try for these partners and practices. They can always just ask a family, is the child engaged in an early learning program right now? They can continue that. They can continue that process. So that's one way that we would sustain the work, is that by changing our habits and our practices. The other way is that, so it's changing, so from the pediatrician's point of view, and I had another thought in my head that just sort of flew out, but I think that the work itself really in the capacity building, so when we have leaders and collaborations who have learned these new models, ways to use data, ways to do a deep dive in a system scan, the importance of engaging diverse perspectives, the value of having a planning process that is answering a root cause, being thoughtful, action learning, all of these different steps, that changes how we do what we do. So even if there's not funding from Race to the Top, you know, Spark Aurora is still going to be funded after Race to the Top is over, and these practices, these habits, can be a part of the collaborations that we've been working with and the habits and work that they continue to do. So in that simple sense, it's sort of, from a habits point of view, we can help sustain the work and continue leading change for communities, leading quality, helping to increase access for more families.
That's great. Thanks, Leah. I just want to take a few seconds here and see if there are any more questions. Go ahead and type those questions into the chat box. And if there aren't any more questions, I'm going to turn it back over to Edna. And thank you so much, everyone, for your very thoughtful questions.
Thanks, everyone. Before we end our webinar, we would like to invite you to participate in our upcoming events. Next slide, please. First up is the Responsible Budget Coalition Rally in Springfield on January 27th. If you're interested in attending, please RSVP by January 15th, and the contact information there is listed. Next is our Federal Update and State Policies webinar on January 28th. To register, please visit partnerplanact.org/webinars, and you can register for that. Finally, our Spring into Action conference is scheduled for March 8th and 9th. This is Illinois Action for Children's annual public policy conference, and you can register for that at actforchildren.org/events. Today's recording will be posted on our Partner Plan Act website, and if you have additional questions, please please send an email to partnerplanact@actforchildren.org. On behalf of the Consortium for Community Systems Development, we'd like to thank all of our presenters and our participants for joining us on today's webinar. Thank you.